Hi there, I'm Sonal Mehrotra Kapoor, and there have been lots of headlines this week, but perhaps nothing as important as the ones that impact your and my health. So, let's take you through all of them. It's been a week packed with health headlines. On one hand, Ozempic is being sued for causing blindness. On the other, a GLP-1 drug just won an FDA approval to treat your fatty liver. What's happening there? What should you really believe? Also, there has been hope for fertility through robots. It's no science fiction. It's actually happening in China and will be possible as early as 2026, though not everybody is convinced on that. And science, meanwhile, is making breakthrough not just in obesity, but balding as well. This is your weekly roundup of all things health and wellness. By now, we all know how revolutionary GLP-1 drugs are. What they do, how they help, is not an unknown secret. But what's perhaps most important, and where all the debate lies, is who is it for? Can it work for you? How will it impact your body cells? And critically, are you really that fat that you need weight loss drugs? Well, I have often asked myself these questions, so after speaking with some of India's finest doctors, this is what we found. The first thing to remember, do not jump in to calculate your body mass index or BMI. Its definition is being challenged and questioned as a sole parameter of obesity. Someone, especially Indian body type, with high BMI may have a lot of bone and muscle mass. Someone with moderately high or even normal range BMI may have body fat percentage, meaning BMI does not conclusively define a fatty body. So, what does, you ask? Let's take you to point number 2. A good way to determine fatness, especially in the Indian context, is to calculate the waist to hip ratio. First, measure the waist circumference and position it right above your belly button. Then measure the hip circumference done at the widest part around your hip. Now divide the waist with the hip to get what will be your waist to hip ratio. For South Asian men, it should be sort of under 0.9, and for South Asian women, it should be under 0.8. Let's move on to point number 3, which is the body fat percentage. Now, this is the most clinical way to determine fatness. The Endocrine Society of India has suggested that it should be 25% for men and 30% for women. The catch here, however, is that it's difficult to ascertain your body fat percentage without professional help. But there are several methods to calculate that. For example, there is a DEXA scan. Ask your doctors about it. It's the most accurate clinical method. What the DEXA scan does is uses low-level X-ray to differentiate bone, muscle and fat, typically done in a medical or research setting. There is also the skin fold test. Now, this involves pinching the skin at various locations to measure fat thickness using clappers. Now, this requires skin fold clappers and the experience for consistently and accurately calculated, again, to be done under supervision. Let's move on to point number 4, the skinny fat. The skinny fat phenomena. Now, the person with BMI 26 may not appear overweight, but could have body fat as high as 38% concentrated around their belly. BMI works on the assumption that all fat is the same, yet the fat around the arms, around your thighs and arms are not as harmful. Many Indians tend to have skinny fat. That means having thin arms and legs, but a big belly, and that is dangerous. Talking about that, let's move on to the next one, which is the visceral fat, the hidden risk everybody warns against. Now, roughly speaking, 90% of the fat in a person is what can be seen on the outside. The remaining 10% is inside the abdomen, called the visceral fat, as it surrounds the internal or the visceral organs, such as liver, kidney. It's the fat you cannot pinch. It's the visceral fat that doctors need to target in the clinic. Visceral or central fat produces toxins, the bad hormones that increase insulin resistance and also suppress insulin secretion. For example, you may not have high BMI, you may not even look overweight, but you might still have high levels of fat around your organs, and that can be extremely dangerous. It also means that you're extremely unfit. And if such a person gets diabetes, you could benefit greatly from GLP-1 drugs. So those are the things to remember. But also importantly, do take into note that India has now entered the big league weight loss drugs market. That means drugs like Vanjaro, Wegovy are out. The demand is real. The drug sales are surging and generics are already on the horizon. But these drugs are not cosmetic solutions. They are evidence-based medical tools designed to tackle chronic metabolic conditions such as obesity, diabetes, particularly when diet and exercise by themselves fall short. Now, these are general guidelines, remember, but before starting your weight loss drugs and medication, do ask yourself these 5 questions that we said, but also the following to your doctor. You must consult an endocrinologist for obesity specialty. Also determine your body type, amount of body fat, not just your weight or BMI. Discuss your lifestyle, your dietary habits, and your metabolic history with your doctor. Take informed decision and make it the right choice. Ever had a gut feeling about something? Or found yourself pacing while trying to make a tough decision? Well, surprise, surprise, that pacing is not just anxiety. That's your body helping you think. That's right. According to the psychologist Barbara Tavaskai, the idea that thinking happens only in the brain is just outdated. In a recent piece in the IAI News, she argues that your body is just as involved in your thought process as your mind. Yes, that means that this meat suit that we are all walking in, there are brains, little signals, well, all over your body. Kind of. I'll tell you how. Now, think with your hands, feet, spine, all of it. Tavaskai dives into the growing science of embodied cognition. A fancy term, well, for something you probably do every day without realizing. Using your body to think. Gesturing while you talk, you see what I did there? Well, helps you form clearer thoughts. Walking to clear your head, that's not just a mood booster. It's a legit cognitive tool. Your body isn't just following instructions from your brain, it's actively participating in the whole brainstorming session. Now, forget the brain-body divide. For centuries, we've treated the brain as the control tower of the body, as the clunky airplane. Now, Tavaskai says, nope, they are both co-pilots. Thinking doesn't float above your body in some sort of cerebral cloud. It's grounded in every muscle, in every sensory experience, even in postures. Okay, try this little experiment with me. Try slouching yet feeling confident. It's hard. It's just not the same. So now you get what I'm trying to say. Therapies are catching up on this science. The mental health word is starting to catch the drift. Practices like somatic therapy, mindfulness, body-based trauma work are gaining grounds. Turns out that treating the mind and ignoring the body is just like fixing your car's software and leaving the engine on fire. So what's required is a bit of introspection. Your awareness of internal bodily signals. Think heartbeat, hunger, tight chest, breathing. All of this is becoming a hot topic. researchers are finding links between tuning in your body and better emotional regulation. Basically, if you listen to your gut, it might stop yelling at you all the time. Bottom line here is, you are not just a brain taxi. So next time someone accuses you of thinking with your stomach or leading with your heart, thank them. They might be more right than you know. And honestly, after knowing this, you might never even look at your elbows the same way again. Stress at work, sleepless nights, burnout feels like the new normal, but some adults are turning to a surprising fix. That's right, adult pacifiers. Silicone soothers, once for babies, now selling out online. They go for anything between $1 to about 70, and fans swear they ease anxiety, cut smoking urges, and even help with sleep. Psychologists are calling it regression, when stress drives us back to childhood comforts. That familiar suck can trigger the brain's instant calm switch.
I could be purple, I could be green or pink or black.
Say it with me now.
So I wore a baby pacifier to school, and now everyone's doing it.
In China, the craze is huge. On Weibo, which is like their TikTok, videos rack up millions of views, and online sales are also skyrocketing, thousands every month. But before you add it to your cart, remember what the dentists are saying. They have a warning. Long-term use can mess up with your bite, can strain your jaw, misalign your teeth, and even block airways if you fall asleep with one. Plus, let's be real, it doesn't solve the stress, it just hides it temporarily.
If there are medications needed, there will be the code, or let's say if psychotherapy of some form is needed, that will be the main aspect. And then you can add and subtract based on people's personality, experiences, likes, choices, benefits. And it's important to see it like that. Just because there is a trend, that does not always mean that there is scientific evidence that it's something which will be applicable for all people.
Experts say try safer swaps, chewing gum, therapy, mindfulness, or even a stress toy. Stuff that helps without wrecking your teeth. Adult pacifiers may feel like an instant comfort, but the real fix is actually facing stress head-on, not sucking it away behind silicone. Pharmaceutical giants are gearing up to flood the market with affordable generics. 2026 is expected to mark not just the arrival of the next generation of weight loss medication, but the beginning of a nationwide health transformation. But is this transformation entirely welcome? And are we prepared for what it brings? But first, let's understand why now. Globally, GLP-1 drugs like Ozempic, Wegovy have already helped nearly 20 million people lose weight since 2021. But in India, access has been painfully slow and painfully expensive. Until now, the core ingredient in these blockbuster drugs, it's called semaglutide, is going off patent in 2026. Not just in India, but in over 80 countries, including Canada, China, Brazil, and Saudi Arabia. Now, what that means is, once it happens, prices are expected to fall hard by as much as 85 to 90%. That means what once cost you about 20 to 30,000 rupees a month could soon be available at just 2,500 to 4,000 a month. This will be a fundamental shift in who gets to access obesity care. We are talking about weight loss drugs from elite clinics in metros and putting them in the hands of everyday Indians. With nearly 33% of Indian adults struggling with obesity, this could have a massive public health impact. But with mass access comes a set of new concerns. While the promise of affordable treatment is exciting, doctors are urging caution. India's leading endocrinologist, Dr. Amrish Mittal says, and I quote, "Whenever prices go down, it always helps our patients. I assume the quality checks will be maintained as generics enter. The challenge, of course, is that misuse will become easier. Misuse might already be happening and it could further increase. But overall, I think the benefits outweigh the challenges. I'm quite optimistic about this move." The issue of misuse is a valid one, a concerning one. And to handle this misuse, countries like Portugal have given only doctors with approved specialities permits to prescribe these drugs as a way of controlling it. Something the doctors in India are now exploring. Padma Shri Dr. Shashank Joshi, who has been at the forefront of diabetes and obesity care in India, says, and I quote, "If and when the drugs become more affordable, it will have a clear impact on the entire spectrum of more than 200 conditions which are impacted with people living with obesity. The cosmetic use and the misuse off-label needs to be contained because these drugs have compelling data on complications and even comorbidities must be given under expert supervision." So it's clear there is a genuine sounding of caution. But there is also a flip side to the generic race for weight loss drugs. With patents expiring, the doors will wide open to Indian pharma players to jump in, and they are wasting no time. Over 10 Indian companies have already filed for clinical trials, mostly for oral versions of semaglutide, meaning injections won't be required anymore. Add to that the competition from Chinese manufacturers, and what you get is a perfect storm of falling prices. But remember, this isn't just a drug story. The ripple effects across the healthcare ecosystem could be enormous. For example, insurers may begin covering weight loss therapies. Hospitals may roll out dedicated obesity programs. Startups are already building subscription-based models that combine medication, coaching, and lifestyle tracking. What this means, in conclusion, what does this mean for you and me? What once costed 30,000 a month treatment is set to drop to 3,000 or less. That's a game changer, not just for individuals, but for India's public health system. 2025 has already seen early entry of next-gen weight loss drugs into the Indian market. 2026 will be the year they go mainstream. But if we want this revolution to truly succeed, we need more than cheaper drugs. We need education, regulation, and ethical oversight. Because if we are not careful, India could end up facing the same problems the West is already struggling with. From overuse and side effects to social media-fueled obsession. And that's not the kind of healthcare transformation anyone wants.